Thanks for tuning in. In this video, we're just going to discuss the differences between amiodarone and lidocaine. When I started my career in critical care, all we used was lidocaine. I love lidocaine. And soon after that, amiodarone was born. Now, there's a big difference between these two drugs. Who's ever running this code is going to decide which antiarrhythmic they want to use. After the third shock, the patient is going to need an antiarrhythmic. There are basically four antiarrhythmics. We have lidocaine, amiodarone, procainamide, and sotalol. And we don't use a lot of IV sotalol in this country, so now we have lidocaine, amiodarone, and procainamide. It's not uncommon for pediatric patients to use procainamide or lidocaine. With adults, historically, we've been using a lot of amiodarone. Let's just discuss the two. In an adult code, after the third shock, the heart's going to need an antiarrhythmic. You could push 300 milligrams of amiodarone, or if they decide to use lidocaine, it's 1 to 1.5 milligrams per kilogram. So let's compare. It doesn't matter what you weigh, we're pushing 300 milligrams. This matters what you weigh. We're pushing 1 to 1.5 milligrams per kilogram. I would bet most adults are about 70 kilos, so that's one dose. Amiodarone doesn't start working for 10 minutes. I don't have 10 minutes. This works instantly. You're going to love lidocaine. This is an instant society. This will instantly stop VTAC. This won't start working for 10 minutes. Amiodarone won't become therapeutic for 1 to 2 weeks, and it has, I think, a 47-day half-life. That's enormous, right? 47-day half-life. So I guess you could make the drip next week, but just realize whichever drug they pick, I'm behind you getting the drip secured. So they can't switch halfway. If they pick amiodarone, they might push 300, and if they want to push another 150 later, they can. But I'm behind you making an amiodarone drip that will hang for 24 hours, and then they'll go on PO amiodarone, like Cordarone, Nexterone, Pacerone. So this is a very long half-life. Where lidocaine works instantly, but has a very short half-life, this is going to wear off in 20 minutes. It's the same lidocaine you would use, say, if you were starting a central line or putting in a chest tube or short-acting numbing medicine. So this is going to wear off in 20 minutes. So you want to get your lidocaine drip ready. Either way, there's drips coming behind you. Let's keep comparing this. I think amiodarone is super expensive. Lidocaine is honestly very inexpensive, but this works instantly. What a great feature. This widens your QT interval, which unfortunately sets you up for cardiac arrest, and this narrows your QT interval. Lidocaine is one of the few drugs on earth that narrow your QT interval, which is critically important. The longer they are on amiodarone, the problems won't occur most likely in the codes when you push 300. You might even push 150, and then the amiodarone drip will hang for 24 hours. It's after that. 10 to 17% of patients have pulmonary toxic effects from amiodarone, pulmonary fibrosis, too stiff lungs. That's why we don't give it to infants and children. The longer they're on it, the more side effects are going to concur. 25% of the patients on amiodarone have to come off this medicine due to side effects. If they're on amiodarone, I think it's for greater than 18 months, they can actually turn blue. Like in science class, the methylene blue, but this is going to lodge in their skin. So that would be a horrible side effect to have blue skin. Humans aren't blue. Whereas lidocaine has none of those side effects. Whichever antiarrhythmic they pick, just realize there's drips coming behind them, but amiodarone has a lot of bad side effects. That's why we don't give it to infants and children. Lidocaine has a potential for having lidocaine toxicity, but if that happens, they'll become confused and it wears off in 20 minutes, so that'll be very temporary. But just so you can understand, there's a big difference between these two, and now they're equal players. If after the third shock, if you've defibrillated your patient 3 times, they're going to need an antiarrhythmic. They could pick 300 milligrams of amiodarone or 1 to 1.5 milligrams per kilogram of lidocaine. Okay, I hope this helps you understand these drugs. Have a great day. Thank you. Bye.